Welcome. You've joined us for this deep dive because, well, you're looking for clear, insightful understanding of something specific, and you want it quickly, thoroughly.
Mm-hmm.
Today, we're diving into the world of pediatric medicine.
Right, but through a very specific lens, we're looking at descriptions of a particular learning resource.
Exactly. Our source material focuses on a book. It's called 100 Questions and Answers in Pediatrics for Medical Students by Dr. Atef Ahmed.
That's the one. We're working from descriptions we have of it.
So, okay, our mission here is to unpack what the source highlights about this book. What does the description tell us makes this thing potentially stand out for medical students?
Yeah, what are the key features that are emphasized?
Yeah.
And what insights about, learning pediatrics can we maybe pull from the source's perspective on this book?
That's the goal. And this is really tailored for you, the listener, someone who wants to gain knowledge efficiently.
Right, understand the core value of resources like this without getting too bogged down in the details.
And based on the source material, there seem to be some interesting points highlighted. Maybe even things you wouldn't immediately expect.
Definitely. Let's dig in.
So where do we start? What's the first thing the source points out?
Well, one of the first things the source really emphasizes is the scope.
Scope, okay.
It highlights that the book provides really comprehensive coverage. It apparently spans a huge array of pediatric topics.
Like what sort of range are we talking about?
It supposedly takes the student all the way from neonatology, the specific needs of newborns, right through to adolescent medicine.
Ah, so dealing with teenagers and their health challenges too.
Exactly, the whole spectrum.
That range is pretty significant, isn't it? Because pediatric care, it changes so much as a child grows up.
Totally different. Treating a neonate versus a teenager, worlds apart.
So the source suggests this book covers that entire continuum. That's quite something.
It sounds like it. But beyond just the breadth of topics, the source also talks about the method the book uses.
All right, the title gives that away a bit. 100 Questions and Answers.
Yeah, and the source explicitly says that Dr. Ahmed, drawing on his extensive clinical and academic background, uses this Q&A format.
Okay.
But it's not just simple recall questions. The description highlights that these questions are actually designed to encourage critical thinking.
Critical thinking.
Yeah, so?
And practical problem solving. That seems to be the key emphasis in the description.
Ah, okay, so it's not just, do you remember this fact? It's pushing you to think like a clinician might.
Precisely. That emphasis in the source on critical thinking through the questions themselves, that's a key point.
And I'm guessing the answers aren't just short, simple things either.
No, definitely not. The source notes that each question is followed by a detailed explanation.
Detailed, okay.
And these answers, according to the description we have, are enriched with the latest research findings, clinical guidelines.
Oh, current stuff.
Yeah, and real-world case studies, too. That integration sounds really important. Bringing in current research, guidelines, and case studies right into the answers. The source seems to describe that as, like, bridging the gap between the theory you learn in class and the practical side needed in clinics.
Exactly. That's how the source frames it. Connecting the what with the how and why of clinical practice.
So by embedding those case studies and current guidelines, the book, or at least how the source describes it, sets itself up as a tool.
A tool to help students see how the information actually applies when they're faced with a real patient scenario or, a simulated one.
Right. And what about the Q&A format itself? Does the source say anything about how that feels to use?
Yeah, it mentions that the format makes the book engaging, apparently, and also easy to navigate.
Okay. Easy to find what you need.
Useful for, say, quick reviews or maybe for digging in for deeper study session, that kind of flexibility.
That accessibility combined with the comprehensive, detailed content you mentioned.
Yeah.
That seems to lead the source to position this book pretty strongly for exam preparation.
It does. The description highlights it as an, quote, invaluable resource for med students getting ready for various assessments.
Like board exams, clinical exams.
Yes, both mentioned. Board examinations, clinical exams, it provides that solid foundation the source believes is necessary for those, high-stakes moments.
Okay, right. So just to recap where we are based on the source.
Yep.
Comprehensive scope, neonates to teens.
Yep.
Q&A format, but geared towards critical thinking, not just memory.
Right. Problem-solving focus.
Detailed answers, bridging theory and practice with current info, guidelines, cases. And because of all that, the source flags it as really useful for exam prep.
Exactly. That covers a lot of ground. Makes it sound like a pretty robust resource, according to the description.
It does, but the source description also brings up something else, something it calls beyond academics.
Ah, yes, that part. This aspect is particularly emphasized in the source material we looked at.
What does it mean by that?
It highlights that Dr. Ahmed apparently includes a focus on a holistic approach to pediatric care.
Holistic.
The description notes this goes beyond just the purely clinical management side of things.
So not just diseases and treatments.
Right. It underscores the importance of elements like empathy,
Empathy.
effective communication, and ethical considerations, especially when interacting with young patients and their families.
Wow. Including empathy, communication, ethics, alongside the medical conditions in a book for students. That really stands out based on the source's description.
It does suggest something, doesn't it? That the book isn't just focused on hammering in medical facts.
Yeah, it seems like it's also trying to shape the broader skill set, the approach needed in pediatric practice.
I think what this emphasis in the source implies is that the author sees pediatric medicine as, well, not just a science of diagnosing and treating kids' illnesses,
But also
as an art that requires a really deep understanding of the child, the family unit, and those sort of human elements of care.
integrating the relational and ethical stuff right from the start, from the learning stage.
That seems to be the idea highlighted in the description.
Okay, so let's try and synthesize this. If we pull together what the source description tells us, Dr. Atef Ahmed's book, 100 Questions and Answers in Pediatrics, is highlighted first as being really comprehensive for medical students. Covers the whole spectrum, neonatology through adolescence.
Right. And the source emphasizes its unique Q&A format, not just for testing, but designed specifically to promote critical thinking and practical problem solving.
Instead of just rote memorization, yeah.
Exactly.
Then there are the detailed answers, integrating the latest research, guidelines, case studies.
Which the source points to as effectively bridging that gap between classroom learning and actual clinical practice.
Making it real.
Yeah. And finally, it's positioned by the source as a highly valuable tool for exam prep, including those big board exams.
Got it. For me, reflecting on the description, the things that really jump out are that intentional use of Q&A for critical thinking.
It's interesting.
And maybe especially the source's explicit mention of that beyond academics focus, bringing in empathy, communication, ethics, right alongside the clinical stuff.
Yeah, that part feels quite significant based on the description.
So understanding how resources like this are put together and what priorities are kind of embedded in them, at least according to their descriptions.
It can really help you as a learner or practitioner navigate a complex field like pediatrics more effectively, right?
Yeah, makes sense.
It offers maybe a way to get to the core knowledge, the practical application, and even those crucial human elements, potentially faster, more holistically.
Absolutely. And thinking about that beyond academics part, the source highlighted the emphasis on empathy, communication, ethical considerations. Here's maybe a final thought for you, the listener, to mull over as we wrap up. The source makes a real point of including these aspects. So what does that suggest about what's truly considered essential in providing pediatric care? Is it maybe even more fundamental than just knowing all the conditions and treatments inside out?
Interesting question.
And maybe how might integrating those elements from the very beginning of your learning journey, like this book apparently tries to do according to the source, how might that change the way you approach both studying medicine and later on practicing it, compared to a more traditional, purely clinical focus?
Something to think about, definitely. What does that early integration really mean for becoming a well-rounded pediatrician?
Exactly. Food for thought.